I'm Lindsey Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. Today, we continue our Year of the Zebra focus on rare disorders and a special conversation with two incredible women. Jenifer Wells, the mother of a young boy diagnosed with ANKRD17-related neurodevelopmental syndrome, or CAGS for short, which stands for the Chopra Amiel Gordon Syndrome, and her son's physician and researcher, Dr. Maya Chopra, a clinical geneticist who co-discovered the gene and who is leading an international study aimed at the better understanding of this rare condition. Osmosis from Elsevier's Year of the Zebra initiative started about 2 years ago with a focus on raising awareness and creating accessible content surrounding rare diseases. To date, we have helped educate millions of current and future health professionals, caregivers, researchers, patients, family members, and the general public about these conditions. We are thrilled to continue learning more from other professionals in the rare disease field throughout this Zebra Focus series. Jenifer also happens to be a colleague of mine who manages the global HR portal at Elsevier's parent company, Relics, which provides digital content and systems supporting 46,000 users worldwide. Dr. Chopra is a pediatrician, clinical geneticist, and assistant professor of neurology at Harvard University. As director of Translational Genomic Medicine at the Rosamund Zander Translation Neuroscience Center, she provides genomic expertise for research and clinical projects at Boston Children's Hospital and other institutions via multi-site collaborations. Thank you so much for joining us today and for your tireless work in the rare disease space. Let's start with Jenifer today, who's joining us, who's one of my colleagues from Relics. And I'd love to learn a little bit more about you, your family, and specifically Dawson, your son, and his journey over the last several years.
Thank you, Lindsey. First of all, I want to thank you for having me on here and giving me the opportunity to share a little bit about our story. My son, Dawson, has a rare syndrome, and as a baby, I would say he was sick a lot of the time, but when it was happening, everything was just kind of brushed off as kids are sick a lot. I didn't really notice that anything was out of the normal, even though I sort of always felt that, like, is this normal? He's sick so much and so severely. For example, he did have RSV at one point and had to be hospitalized. If he picked up a cold, it would be, instead of just being a few days of the sniffles and moving on, he would be sick all week long and need to have breathing treatments and steroids and medicine to just get over common colds and things like that. But when I noticed something was really out of the normal and started to then push for more testing was probably right around the COVID time, May of 2020. We were out for a walk and he had this little pedal car that he rides. And when we came back in, we noticed across his back where the seat had been rubbing had broken out in just a bunch of petechiae. And it looked quite bad. So we went back to the doctors and was noticing the petechiae anywhere anything would rub. So like under the arms, on the back, wherever. And he had a virus. He had picked up musculum virus. And so, but the petechiae was so severe, they agreed, yep, okay, we need to kind of look closer. It's not just a little boy that's been sick a lot. This is like something else might be going on. So at first we were tested for a ton of blood disorders, from anything from cancer to just some kind of blood disorder, clotting, things like that. Everything always just came back, it's not this. So I always felt like, I had that answer of what it wasn't, but no one ever could give me the answer of what it was. So while it was reassuring that he did not have, some this or that or the other, it was still a mystery. Well, what does he have? And so that cleared up. They said, well, it was probably that virus. He just had a really bad reaction to that virus and, got the petechiae and it just kind of mysteriously vanished. But then on September 30th, 2021 is when Dawson had his first major tonic-clonic. During his sleep, I was laying next to him and felt the kicking, and he went into status. He had the seizure for probably 30 minutes and then Todd's paralysis afterward. That's when we were rushed by the ambulance and met the ER team at Cincinnati Children's. And that's when like the testing started about seizures.
So you're in Cincinnati, you're starting to go through the testing. Can you walk us through that part? And then I'd love to bring in Dr. Chopra as well and how she kind of played a role in this story.
Sure. So that night, like immediately, they had us do a CAT scan. And I actually climbed on the CAT scan thing with Dawson because he was so frightened. And we just had to hold real still. And they did a CAT scan. And they said, oh, that looks normal. That's good, right? It looks normal. There's no like stroke or something because he had left side paralysis with the Todd's paralysis. So we stayed there for that evening. They sent us with an emergency medication prescription, and they said it's probably just one off. Sometimes kids just have a seizure one time and, we're not seeing anything. So we're going to go ahead and let you go home with this rescue medicine. And so we did that. And then they've had a follow up to say, get an MRI, go with a neurologist that we have, here at Cincinnati and just follow up with some things. So we did the MRI that showed a small bleed in his thalamus, but it was very remote. And that was pretty much it. And they did an EEG, but it was a small one. It was just like 30 minutes. But that was enough for them to see some patterns that they were like, he is a very active EEG. And they actually called us and they were like, yeah, he's very high risk. He has epilepsy. I'm like, what? I thought kids could just have one seizure, and that was, you're done. Nope. They said he has epilepsy. And we even debated like, oh, does he really need to go on the medicine or, but they were pretty sure he was going to have another one. So we started all the medicines. They also recommended an overnight EEG for Dawson. He did go on to have 5 more pretty substantial seizures, lots of absence seizures. It just, once it onset and kicked off, it just really progressed very, very quickly. Nothing came back on the panels for the standard epilepsy panels for what was causing this. And they didn't think the remote injury was enough that could be causing all this. So we did a West. And when the West happened, it took a little, months. And when it came back, I got a call from our geneticist at Cincinnati, and she said, we have a match, and there is actually a team in Boston that is looking at this. And I just remember having that feeling of relief of, I wasn't told it's not this anymore. Like we had something. And even though there was like still a ton of unknowns and no one could give us answers on all the things, we had something that we could work with. And that's when I was introduced to Dr. Maya Chopra.
Thank you so much, Jenifer, for sharing that. So you kind of assemble this team together. You get to a diagnosis fairly quickly in terms of rare disease diagnosis. And then you're introduced to Dr. Chopra, who has been coined the dream team by Jenifer over here. So Dr. Chopra, can you just explain a little bit about Dawson's case, how you kind of, got to know that family and kind of the treatment plan that you've kind of incorporated in your work?
Yes. So in 2021, myself and a group of colleagues published what we call a previously undescribed or new genetic syndrome caused by variations in a gene called ankyrin D17 or ANKRD17. And this was an effort that took 4 or 5 years to pull together because this is a rare disorder. And at that time, that gene was not known to be implicated in human disease. We managed to identify 34 individuals around the world who shared common features, but also had a degree of variability between them. And this was then recognized as a new genetic condition. And really the key features were neurodevelopmental issues, learning issues, developmental delay, epilepsy, and some physical features, along with sometimes some quite significant feeding and growth challenges. What happened was that after that paper was published, I continued to receive emails from families all over the world, from physicians wanting to participate in further research, wanting to understand more about the disorder. And it became very quickly clear that the job was not done, that describing this as a new condition was only the first step. And the next step was to truly understand the longitudinal trajectory of this condition, to understand the biology, to understand the impact on families, and to get us to a point where we could even start thinking about clinical trials. So we launched a new study at Boston Children's Hospital, a natural history study, and it was through that I had the pleasure of meeting Jen, Dawson, and the whole family.
Thank you so much for sharing that, Dr. Chopra. So can you speak a little bit about just how rare this disorder is and what the current state of treatment is today?
We probably know of about 100 individuals around the world who have this condition, but I suspect there are a lot more. Some that just haven't come to any medical attention. Perhaps they're on the milder end of the spectrum and haven't had genetic testing. And this is particularly the case for adults and older individuals. Or perhaps they have been diagnosed but have not managed to connect yet with the community, either through our research or through the community building that Jen is so passionately leading. It may be that differences in health systems mean that there are different access to health services. And finally, it might be that people had genetic testing many years ago before this gene was even described. And so their result, their variant, is sitting somewhere in a database, but hasn't been tagged as pathogenic or as being of interest. And it just speaks to the importance of having negative exomes or negative genomes reanalyzed and reevaluated, because new gene-disease relationships and genetic mechanisms are emerging at a really high rate. In terms of prevalence, I'd hesitate to make an estimate, but if I had to, I would say maybe 4 or 5 in a million individuals would have this condition. I would say that for individuals who have intellectual disability or neurodevelopmental presentations, even within that cohort, it would be very rare. It would be less than 1% have a disorder with an ankyrin D17 variant.
Can you speak a little bit, Dr. Chopra, on what is the treatment plan for individuals like Dawson?
Right now, like for many rare disorders, there's no specific treatment. The treatment, the management plan is very much tailored to that individual's challenges. So certainly support with learning, development, management of epilepsy, surveillance for the physical features, genetic counselling for the family, review of all systems, ophthalmology, for example, kidney ultrasounds. We have children who have only one kidney in our cohort, and follow-up for the predisposition to recurrent infections. But we don't have a specific precision treatment, and we'd like to work towards this, to not just be able to treat some of the complications or the symptoms or the manifestations, but to actually get down to the root cause of this rare disorder.
Absolutely. And I want to kind of pivot over back to you, Jenifer, as your family is going through these, this journey and these treatments, just to get your perspective on how that's been going.
It's been going well. And like Dr. Chopra was saying, it really is a treatment of the symptoms. So our primary for Dawson was getting the epilepsy in control, because that was one of the main manifestations that was causing a lot of damage in his brain. And, a big regression happened where he had to learn to rewrite, and even some of his speech was being impacted there for a while. So getting that in control was one of the first things that we needed to do. And then, since we are mostly controlled with that now, is the therapies. I can't imagine if we didn't jump on that right away, the delays that we might even be seeing. Dawson immediately started occupational therapy, physical therapies, learning interventions, and, just trying to find the ways to help him through that and support him so that he could regain his skills that he lost and then start to build again on them and start to learn again. So just following that and trying to do that.
Absolutely. And I think it's really incredible to hear both perspectives from the provider and researcher and the parent here. So thank you so much for sharing that, Jenifer. Dr. Chopra, can we talk a little bit about the study that you are conducting at Boston Children's Hospital?
We're conducting a natural history study on this disorder. We are very fortunate to have such great engagement in our work. We don't need to go very far to find participants. They generally come to us through a Google search, through clinicaltrials.gov, or through the network of rare disease physicians that we have around the world. In our study, we enroll individuals. We try to see them in person when we can, if they're able to come to see us, and we are able to provide some travel support for that. We do a medical reviewing what are their main issues, what's their growth like, what's their feeding like, what's their development like. And for those individuals who are interested, we're able to do a formal neurocognitive evaluation. And this is standardized measures of cognition, of behavior, of development. And the idea is to try and put some standardization into the way that we evaluate and describe this condition. For example, in our discovery paper, when we first delineated this disorder, we had several physicians reporting that their patients had autism spectrum disorder, speech and language difficulties, and this was really prominent. And we felt that the speech and language difficulties were out of keeping with what one might expect with cognitive level. So we really want to do these very standardized assessments in order to validate what was probably an observational finding in our first paper. We are collecting MRIs, we're collecting medical records, we are collecting photographs with permission, and we have expanded our study such that we have now 3 points of contact. So contact at year 1, and then year 2, and then 3, because really what we want to understand is what is the longitudinal trajectory? What happens to development? So when families ask me, look, my child has a bit of speech delay, are they going to catch up? What happens when they have speech therapy? How many develop epilepsy? What happens to their growth? What happens to them during puberty? So this was a huge effort to expand the study to this extent, but we've been fortunate to have such interest and to have some support to be able to do that. In parallel, we're also trying to understand the biology of the disorder. So we have collected samples of skin from affected individuals and a sex-matched control parent, which are being reprogrammed to iPSC cells. These are stem cells that can be reprogrammed to any differentiation type. And they'll be differentiated into neurons because, of course, this is primarily a brain disorder. And we need to understand what's different about the brains, the neurons of kids who have CAGs as compared to those in the general population. And those modelling approaches will then be a foundation to test therapeutics. So these are all what we would call the building blocks towards clinical trial readiness. We've tried to incorporate the family voice with quality of life measures and with parent rating scales so that we can understand what are the challenges to families. Because when we talk about treating rare disorders, what are we actually trying to treat? What is the important, what's the most important parameter for families? And how do we measure that? And how do we measure it in a way that we can prove that how do we track it over time and then be able to prove that it can, we can change that trajectory over time.
So this study sounds like it is ongoing. Are you able to share how many patients you have enrolled in this ongoing study? And secondly, is there anywhere that, if any of our listeners were interested, where they could learn more about this study?
Yes, we have about 50 individuals enrolled. We expanded our study recently to also be able to include a small handful of patients who may have the diagnosis, but it hasn't been confirmed. And the reason for that is we have sometimes challenges with interpretation in variants, so variants of uncertain significance, we call them, which don't meet the criteria for pathogenic, which don't meet criteria for definitely having a diagnosis. But in order to understand the full spectrum of the disorder, we need to really capture the full spectrum of variants, and it helps us understand about the gene. Families can find out through clinicaltrials.gov, and there are contact details there, as well as some information about the study.
Amazing. Thank you so much for sharing that. And one last kind of question in this kind of research space. Is there any other kind of promising research that you're kind of seeing in this CAGS space?
I think this is a gene that we just don't know very much about. We know it's important for the brain, but we don't know exactly what it does. It may be that it controls expression of a range of other genes through development, and that seems to be the working hypothesis. But one of the challenges is that we don't have a complete understanding of the function of this gene. And I would say the most promising steps that we're trying to take are to get a little bit closer to that answer. How does it regulate other genes? What's what we call transcriptional signature, the other genes that it regulates? What do they do? And where is the opportunity for targeting in terms of treatment? So this is a haploinsufficiency disorder. So kids who have this disorder have one working copy of the gene and one that has a gene fault or is loss of function. And one of the areas that we have our very close eye on is, can we upregulate what we call the wild type copy, the copy that's working? Can we get that copy to produce more angrin D17 protein? And can that ameliorate the symptomatic trajectory? And at which time point can we do that? And what happens if we overshoot the mark? These are all the sorts of questions that we are thinking about and discussing and learning from other rare disorders. We don't work in isolation. We study a range of disorders within our work as researchers and have a lot of cross-talk. Because although this is rare and unique, there are many challenges that are shared with other disorders: speech, language, neurodevelopment, epilepsy, so at a symptomatic level, but also at a biological level. These genes are often very closely linked. They form networks or are within the same pathways. And it's really important that we keep an open mind in sharing what's common with other disorders as we move forward with research.
Yeah, absolutely. Thank you so much. And we'll be keeping an eye on your incredible work, Dr. Chopra. We'll be watching the space for sure. I want to kind of pivot a little bit back over to you, Jenifer. I know that you've been able to really build a strong community and lean on other parents. Can you speak a little bit about kind of developing that community and, really having kind of that network to lean on?
Yes, so there is a Facebook group for ANKRD17, CAGs, and that's where the families have been coming together. So I help set that up and just try to, share stories, share resources. We have a lot of conversations about what's working well. What are the challenges that people are seeing? And I've just seen that community grow. We're up to 70 members now, and it's becoming a really great resource for families to share their stories and not to feel so alone or scared, maybe even about, what does this mean? The other great connection is we do have some adults in the group now that have CAGs. And so I know for me as a mom with a kiddo with CAGs, it's reassuring and it's also interesting to be able to connect with an adult with CAGs so that you can see, how are they feeling? How did, the longevity of things, like how did that look for them, living with CAGs? So it's just becoming a space that we can grow together and learn together. And then through the help of Dr. Chopra and her research team, as materials become available, or if they're able to share things, then I try to partner with them to get it out to the community and have those resources available.
That's incredible, Jenifer. And I think this is something we've heard a lot through our work with Year of the Zebra, is how critical it is for other families to, connect with other families kind of in that similar space and share their experience. It can offer hope and advice and, recommendations to get them to Dr. Chopra as quickly as possible. So I think that connection piece is so critical. Jenifer, one kind of follow-up question is, what has kind of been your biggest takeaway throughout this experience with a child with a rare disease condition as a parent and an advocate?
To keep searching. I would say that to parents, don't give up, keep looking, keep testing. Even if you tested before, test again. Because, had we tested even years earlier when Dawson was first experiencing like, hey, something might, I may not have been connected with Dr. Chopra. And that's because research is being added all the time and new findings are happening all the time. So don't lose hope. Keep trying, keep searching. And it's okay that there's unknowns. Like that's been the biggest takeaway for me is like just learning to take things day to day and, trying to do the best that you can do without overly worrying. There's a lot of great researchers. There's a lot of wonderful doctors that are looking and trying to come up with the targeted medicines and the answers. You just may not get them right away.
Some really good takeaways there, Jenifer. And I want to toss that question over to you as well, Dr. Chopra, on kind of what is your, biggest takeaway been in this space as you continue to do research on CAGs?
I would say it's become very clear to us how inspiring Jen's work is and how quickly and beautifully she's pulled that community together. And we hear that. We hear that in our consultations. We hear that in our research visits. Families will reference the Facebook group, ask questions about the Facebook group. Sometimes they even find out about the study through the Facebook group. And we've watched it grow. We every now and then have a look at the membership. And I remember when there were, 2 or 3, and now we're up to 70. It's quite remarkable. It's so important as researchers that we engage and include the families in our research design, in our methodology, in understanding what are the most relevant and meaningful endpoints that we're going to use for clinical trials. I've learned that research is hard and needs funding and resources, and that's really difficult in the rare disease space. But I've also learned that if we leverage the infrastructure that's around us and if we leverage the commonalities we have across disorders, we can make small studies more scalable. And we are looking at that now with trying to scale what we've done with CAGs to a range of other rare disorders which overlap either mechanistically or phenotypically through the features that we see in the families. I'm very hopeful that we're going to make progress, but it's just not going to be as fast as I think some of the families would like it to be. I'm sure many families are looking for a specific precision treatment very fast. But good scientific research, well-designed clinical trials take a bit of time. And that's something that we all have to try and balance, that sense of urgency, that sense of timeline from the families versus our sense of the importance of scientific rigor. And that kind of push and pull, we both need to hear each other and we both need to feel that tension and find some kind of balance in between.
Yeah, and one of the things you kind of touched on, I think feeds really nicely into kind of our next question of what's next for both of you kind of in this phase. What's your hope of what you kind of see coming next? It could be moving along into the trial space, but want to give you both a chance to answer that question on what is next. And maybe we'll start with Dr. Chopra on this one.
Oh, yeah, I'd love to continue to see more families. I'd love to see more families in person. I would love to work on the kinds of measures that are most meaningful for clinical trials. I'm very excited that our specimens have reached their iPSC stage and we're now differentiating those into neurons and really trying to understand how they're different. Are they morphologically different? Are they functionally different? Transcriptionally, are they different? To really get to the biological basis of the disorder. And then, as I alluded to, I think expanding what we've learned about CAGs to other disorders, particularly those that have a haploinsufficiency mechanism, in order to harness everything we've learned, all the infrastructure we've established to the broader rare disease community. So I'm really looking forward to working with the CAGs community to take those steps and make this into a giant leap.
Thank you, Dr. Chopra. And over to you, Jenifer, on what's next for you and Dawson.
Yeah, so as for CAGs, just continuing to grow the community and, raise the voices of the CAGs families, see what it is that's important to them. I would love to set up a CAGs foundation in order to support the research and, be able to have like an official name for our community. And that can open up a lot of doors for other things, for grants and, just becoming a true foundation community. Maybe help support any kind of efforts with registries of, collecting data, just really hoping to be helpful and be a parent advocate for Dawson and for all the other voices in the group, and helping the voices that want to be a part of that and want to join, to have something to join and a mechanism and a place where they can be a part of that too.
That community piece is so inspiring, Jenifer. So thank you so much for all of your work there.
Oh, thank you.
I've got one final question for you guys, and then we can wrap it up. But as you know, Osmosis is a medical education company. A lot of our audience are future medical professionals or practicing medical professionals. What advice would you give them from the parent and the provider kind of perspective on any tips on handling patients in the rare disease space?
Oh, that's a good one. I have 2 pieces of advice. My first piece of advice is a little bit of a mantra for pediatrics, but listen to the parents, especially those that tell you that they have an instinct or a gut feel about their child and that something just doesn't fit. Something doesn't quite fit with what they've been told or what the supposed diagnosis is, or that they just have that instinct that something's not right. And I think that is such a key piece and such a recurring theme amongst rare disease families to be heard. My second piece of advice would be that genomic medicine, I think, should receive, in medical education programs, should receive a little bit more of prioritization. I think genomic medicine should be integrated across specialties to some levels. So being able to take that family history, being able to understand how to refer for genetic testing, how to interpret genetic testing, I think that we need to, as a physician community, do a reality check on whether we're achieving the right level given this genomic revolution that's coming our way. So I would urge all students to really stop and think about how they can have some experience or training in genetics, not just for rare disorders, but even for those more common disorders for which we're now understanding the genetic contribution.
Thank you, Dr. Chopra. 2 really helpful tips for future and existing providers. Let's go over to you, Jenifer. What tips would you give any practicing physician who might come across a rare disease patient?
I would echo what Dr. Chopra said as far as, please listen to the parent and thank you. I would say thank you to all of them. Our children really are waiting, and there is so much work in this space that is still the unknowns. So anybody that's studying this, anyone who is finding their calling and their passion in this space, I just want them to know that all the hard work and maybe the late night studies and all of the things that go along with such a complex field, as a parent, I appreciate it. And it's not just that I appreciate it, it's like my child's life is dependent on that, his quality of life, his options, his, everything. So it's just such important, and it's such high value. Like we really, really appreciate from the parent's point of view when we are heard, when we do have a physician or research team that takes an interest, it really does mean a lot.
Absolutely. And the work that Dr. Chopra and her team are doing is so, so important. And so we thank you for that, Dr. Chopra. We're going to get ready to wrap this episode up. But before we do, I just want to make sure that if there's anything that I didn't cover, that we cover. So any last remarks from Jenifer or Dr. Chopra? Let's maybe start with Jenifer if you have anything else to add today.
I think most everything was covered, but feel free if you do have ANKRD in your genetic results, or you have been told that CAGS is part of the symptoms, please feel free to reach out through the Facebook group or go to the website and learn more about the clinicaltrials.gov. We would love to have you part of the study with Dr. Chopra. The more voices and the more information that we can have in here, the better chance that we have to get those answers. So, please reach out and join, and don't give up. Retest if you need to.
Thank you, Jenifer. And over to you, Dr. Chopra.
Just to recognize Jenifer, I think, and the community and the amazing support that we've had for our research. We couldn't do it without Jenifer, her family, and the community. My amazing research team who are out there and working hard as we speak, enrolling families and doing consents and collecting information. And I think I have to recognize the infrastructure of the institution of the Rosamund Zander Translational Neuroscience Centre, where I'm based, and of course Boston Children's Hospital. When you are in a setting of excellence, you aspire to be at that level. And I think I've been very fortunate to be in a place where I can continue to do the research that I'm passionate about, but know that I'm doing it in a way and with a team and with a community of mentors that I think I can only do the best that I can in that sort of setting.
And I think you're doing very well, Dr. Chopra. So we thank you and Jenifer for being with us today. This was a wonderful episode of really getting that parent perspective and provider and researcher perspective on CAGs. I'm Lindsey Smith. Thanks for checking out today's show. Remember to do your part, raise the line, and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.